The longer you leave it, the more damage is potentially happening. So better you get in the first 30 minutes than the first hour, and better you get in the first hour than the first 2 hours. Just get in as quick as you can.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today, as we approach International Stroke Awareness Day on October 29th, we're focusing on the key messages of the HSE Stroke campaign. Our guest today is Sinéad Coleman. You're very welcome, Sinéad.
Thanks, Virgo.
Sinéad is the Programme Manager with the HSE National Clinical Programme for Stroke. She also works as a physio in St. James's, where she works with people in the aftermath of stroke. Sinéad, so you're working on the coalface, on the front line, but you're also working on the development of this campaign. Can you give us the key messages of the campaign so we get everybody on the straight and narrow here?
Yes, so people are familiar with the FAST campaign that has run before. It just hasn't been on the TV for a few years, and we've seen numbers dropping off with patients getting to hospital on time after a stroke. So we felt it was really important to get the message out there again. So FAST stands for face. Is your face drooping on one side? Arms, can you lift both arms up and keep them up? S is for speech. Does your speech feel slurred or maybe a little bit garbled? And then T is for time. So this is probably the real message, the key message we're trying to get across, as we know a lot of people are familiar with the F, A and S, but it's the acting on it is the really important piece. So our campaign is called Every Second Counts. So the second you suspect you have any one of these symptoms, that's another thing people maybe feel they need to have all three. You just need to have one. So the second you think that is happening, or it could be your loved one, it could be you're there in the room with somebody and you notice their speech has gotten a bit slurred, that's when you need to ring 999 or 112. Don't wait to see if it settles or resolves, or act on it straight away.
I think we have a problem in Ireland to hopefully think to ourselves, it'll be grand.
Yes.
Or we'll just give it a minute here. That's funny enough the key message not to do, just as you said there, isn't it?
Yeah, exactly. And this campaign is a bit different in that it's based a lot on behavioural research. So Paddy Doyle is a registrar he's working in James's now. He was in Tala at the time. He did his fellowship on this. So there was a lot of research done around, this might be a stroke, why aren't you going in straight away? And a lot of it is that Irishness, maybe a little bit of, I don't want to bother anyone. It'll probably be fine. It's only mild. It'll probably go away. So that's why we're really trying to get across the people that don't wait to see if it settles or goes away. You won't be waiting in ED. You'll be fast tracked through the pathway. Just act on it straight away. Don't wait. You're not bothering anyone. You're not putting anyone out in the hospital service. People want to see you coming in to help you.
Yeah, so let's talk about that fast track system, because I think that's very important. Obviously, different A&Es at different waiting times, and it can be a challenge, the reality of it. But if I'm coming in or I suspect a stroke with myself or with somebody else, and we're ringing the emergency services, we're getting the ambulance in, tell me about that pathway.
So I suppose the main thing is that you do ring an ambulance. If you drive your loved one to the ED, there is a slightly different pathway. So you do want to ring 999 or 112. You want to tell the responder on the phone that you're suspecting a stroke, again, whether it's you or your loved one. And that straight away triggers a fast call with the paramedics. So when they come to get you at home and bring you in, there's a stroke team waiting to meet you essentially in the hospital. They'll bring you straight through ED to get your CT brain done. You're not been triaged, you're not waiting in ED, you're brought straight through.
So the whole system knows that the time pressure is the key pressure on this, and the time message is the key message of the campaign.
Exactly. And again, it's called a fast call. So that is the message we're getting across. So everyone's aware of fast, from patient all the way through to the paramedics to everyone in the hospital. They know what it means and how urgent it is.
Yeah. And just to reflect a minute on the previous campaigns, because when I saw this, I thought, I've seen that before. I've seen the posters and they're scary. I paid attention to them, and I don't pay attention to every poster. You know what I mean? So it's interesting that you believe that it's in the public consciousness that there's a certain level of awareness here.
Yes, exactly. As you say, people, they've seen it before. The UK would have similar campaigns, so they might have seen it if they're watching TV, a UK channel. The advocacy groups here in Ireland have run it in the last couple of years, maybe not on the TV, but they might have heard it on the radio or seen it on social media. So it has been around. There hasn't been a TV campaign in about 10 years, and we know that's what really works. And yeah, it's, as you say, everyone's aware of it. It's to get it back into people's memory. Like I said, I think the main thing is a lot of people, even when they were asked this time around in the research, they thought they had to have all three signs. So any one of them at all, and you just act on it straight away.
Yeah, I've seen some of the TV ads. There's a birthday
The hard
party
hitting,
on.
yeah.
I think it's the face that goes.
Yes.
There's a father and daughter playing tennis, and all of a sudden he kind of goes limp to one side.
Yeah.
And the mother just like ring the ambulance. You get that kind of chaos shown to you, but the decision is very clear.
Yes, exactly. It isn't oh, are you okay? And let's go home and see what happens. It's ring an ambulance. And look, if it isn't a stroke, brilliant. You know, it's great if it isn't, obviously, but if it is, you need to be heading into the hospital straight away.
And you were part of the working group around this development of this campaign. Can you tell us a bit about your experience with that?
Yes, it's really interesting. So worked really closely with HSE Comms, and they were wonderful. Obviously, they've done this before. Also on our working groups, we would have had the National Ambulance Service, Dublin Fire Brigade, our patient representatives who are wonderful because they've been through it and they were able to share our experiences. Some of them acted on it straight away, others didn't. And obviously then other physicians around the country, consultants and nursing staff that would work with stroke on the front line. Advocacy groups were very important in the journey as well. And then the Irish National Audit of Stroke would have been really important. They work under NOCA. They would have made that initial recommendation 2 or 3 years ago in one of their annual reports, because they saw the data that the numbers of people presenting to ED in that sort of critical 3 hours was dropping. So they made a recommendation that we get this campaign up and running again.
Yeah, that's interesting. I'm surprised about the amount of people reading the PR on this, that 7,500 people experience stroke in Ireland every year. That's an awful lot of people.
It is a lot, and it's the top cause of adult neurological disability in Ireland. So it is, again, it's the quicker you can get in.
So it's a life-changing event, full stop.
Yes.
Yeah.
And look, we do talk a little bit about 3 hours or whatever, but again, the longer you leave it, the more damage is potentially happening. So better you get in the first 30 minutes than the first hour, and better you get in the first hour than the first 2 hours. You know, just get in as quick as you can.
Okay. So essentially we're looking for people to arrive in hospital within that critical treatment window. And that's going to be the measure that, as you said, that clinical audit review targeted this area.
Yes, so it's really good. We have our Irish National Audit of Stroke. So the time to ED is just one of the many data points that's recorded. So it's all about quality of care. That's why we audit. But that will be one particular piece that we'll be looking at. And then other things. So that data is always maybe a few months behind. But something we're looking at sort of straight away is the number of fast calls that the National Ambulance Service is getting, the Dublin Fire Brigade is getting, the number of hits to the HSE website, looking for information about stroke, looking at the ads. So there is other pieces we're looking at before that data comes in. It'll be a quarter, about 3 months behind with the data.
And we have Stroke Awareness Day at the end of October 29th. But the big focus for that Awareness Day is these key messages, isn't it?
Yeah, so it's working out really well for us here in Ireland with the campaign. So World Stroke Day is on the 29th of October every year. Fergal, as you're saying, it's an international awareness day, so for all over the world. And it sort of happens that this year the theme is the FAST campaign and just people knowing the signs and symptoms and, again, just acting immediately on it.
You work as a physio. I know you work with the stroke at a national level as program manager, but your other job as a physio, you're in contact with people that have experienced stroke every day, or that you're in James's.
Yeah, so I work the first half of the week with the National Clinical Programme for Stroke, and then I work the second half of my week in James's. I've been working in James's for 20 odd years now, and I've specialised in acute stroke for the last 5 or 6 years. I was specialising more in rehab just before that, where I would have done more the rehab side for stroke, and now it's much more that acute side. So I work in the acute stroke unit with the rest of the multidisciplinary team. So literally a patient comes in and we go in the next day, or even later that day if they've come in overnight, and assess them for power, sensation, how they can move, see if they can get out of bed, if they can walk. And we pretty much start with them straight away, which is great.
Yeah. So you've got that wraparound instantly once they've recovered in some way.
Yeah, so once they're medically stable, we get them up straight away. I think sometimes patients can be a little bit surprised with how quick we go into them, even after they've had those life sort of saving or life changing medical treatments. Thrombolysis is and dissolves the clot. And thrombectomy is where they would go to Beaumont or Cork to have the clot surgically removed. And even within a day, we're getting them up and moving again after that. Yeah. So it's really just getting people up as soon as and obviously they have to feel okay. You know, if they've come in overnight and they're exhausted, we might just do a few minutes just to get started with them and just assess how they're doing. But the next day, it's get them up and put them through their paces, hopefully.
You're a physio.
Yes.
By career, but I think of the psychology of what you're doing there. Like, where are these people at? It must be a shock to the system that this has happened to them.
Yeah, and I think for everyone, if they've had a stroke, it's a massive shock because it's so sudden and a lot of the time there's no warning. And one day they're going about their normal life, working, family, kids, you know, hobbies, whatever they do. And the next day it's changed, you know. And sometimes I think maybe for patients who don't have maybe other medical issues and are very fit and healthy, it's probably even more of a shock for them because it's very unexpected. We often have patients coming into James's that are in their 30s, 40s, 50s. They have young kids. They're still in full-time employment. We've had 20-year-olds coming in, they're in college. It is all ages. And I think that's why we felt the ads were important as well, that it does show that younger cohort of patients, because people think a lot of stroke is older patients, and it is, but there's a lot of younger patients as well.
I would have thought from a health and wellbeing perspective, like we're obviously usually talking about promotion and prevention in relation to the health and wellbeing podcast content. But I would have thought in terms of stroke that you're talking about managing high blood pressure, controlling diabetes, cholesterol, knowing where you are in your heart conditions. And so I did think it was that 50, 60, 70. But you're saying that it's not.
No, and like I said, majority of patients are older, probably 2/3 to 3/4 are over 65. But that's still a lot, as you say, if the 7,500, you're looking at probably 1,500 are under 65. Sometimes high blood pressure can affect people in their 40s. So a lot of the time it can be that. If it's someone in their 40s, they maybe didn't realise we're walking around with really high blood pressure.
I suppose if you have some undiagnosed condition, it's only going to bubble up maybe in your 40s or late 30s.
Exactly.
You know?
Yeah. Really, once you hit your 40s, you do want to be going to the GP every year and just getting everything checked. So getting your blood pressure checked, getting your pulse checked. So high blood pressure and atrial fibrillation would be two big risks for stroke. But once they're diagnosed, they can be managed and treated. So it's just important to get in and get tested by the GP. They're quick checks. They may just recommend a lifestyle change initially to see if it can be controlled, and otherwise you may need to go on some medication, but very well controlled, and you know, you're really reducing the risk after that. Other prevention for stroke would be the usual for everything. Stay physically active, do your 30 minutes, 5 days a week minimum, healthy diet, don't smoke, watch the alcohol levels. If you're on medications, stick to them. Don't decide, oh, I feel okay, I don't think I'll take them for a few days. If you're on a medication, you're on it for a reason. And I know you were saying about the younger patients, sometimes there might be an undiagnosed hole in the heart or something like that that can throw off a clot.
That happened to a friend of mine, and we didn't know why a 20-something would be having a stroke.
I know.
Yeah.
I know, big shock. As a physio, I love my job and I love getting to know people. And unfortunately for the patients, they can be with us for quite a while. So we do really get to know them.
Yeah. So you have to bring them through. Let's get back onto the care journey.
Yes.
So they've come in the door, they've got their medical treatment. And as you said there's innovation in that field.
Yeah.
We're blasting these blockages out of the way and see where they can go physically.
Yes.
And that's your journey.
Yeah, exactly. Straight away in the stroke unit, the whole team obviously is involved in their care, from the nurses, the docs, to all the therapists, social workers, dietitians, everyone. An awful lot of stroke patients are very mild and they're home within 2 or 3 days. But again, it's the medical piece of that is really important because they need prevention, because if they've had one or even a mini stroke, there is a risk of another one.
Okay.
So a lot of it is they're going home on the right medication and that they stick to that. And then obviously if patients need to be in with us a little bit longer, St. James's is an acute hospital, but your rehab starts that day or the next day. So they could be with us for a number of weeks while they wait to go on to a rehab facility. For example, the NRH or PMount from us, they can be with us for a couple of months sometimes. A really wonderful advance in stroke care in Ireland over the last few years is the addition of early supported discharge teams.
I was reading about that actually. Yeah, no, that sounds good. Tell us more. Early support discharge.
Early support discharge. So we have 11 teams at the moment and we got funding to get 4 more teams this year. So we're hoping to have 15 teams up and running by the end of the year.
This is all part of the National Stroke Strategy.
Exactly.
Yeah.
So it's made up of physio OT, speech therapy, social work, clinical nurse specialist and a therapy assistant. So What happens is if a patient, it's usually for mild to moderate stroke. So if somebody needs maybe assistance of one to move around and they have family at home that can support that, the patient often gets home a few days early, has the rehab at home. The team can see them for up to 8 weeks at home. So they come and see them in their home. And as you can imagine, that's really useful for setting goals because they're at home in their own environment. Yeah. So that's been such a successful addition to the stroke pathway. And that annual report is going to be launched, I think, on World Stroke Day as well. Ciara Breen is part of our stroke programme team. She's the lead of that. So really amazing numbers going out. All the ESD teams work really hard and the feedback from patients is wonderful because they want to be home.
Yeah, sure. Why wouldn't they be? Like, it would be such an amazing service to have.
Yeah.
Professionals coming into your setting, trying to join the dots. So tell me more about nationwide. How many of those systems and supports are in place? You work in James's.
Yeah.
How does this service for stroke map out across the country?
So there's 24 acute stroke units around the country. So obviously, if you're very rural, you might have to travel a little bit.
Yeah.
But there would be a stroke unit in most counties around the country. And obviously, there'd be quite a few in Dublin. So again, if you ring an ambulance, they're going to bring you to the nearest one to you. If you do need to go for thrombectomy, which is that surgical removal of clot, the two options are Cork and Beaumont. So depending on where you live and the first hospital you get brought to, you'll be brought to the nearest one for that ongoing surgical piece. And then normally you're brought straight back to your original hospital. You have the surgery and if everything's okay, you go back to that first hospital, which again is near where you live, near your family more than likely. For everyone would have a multidisciplinary team attached to their stroke unit. And then not all sites have access to early supported discharge yet. But the plan is before the stroke strategy is finished, which is in 2027, that every site would have access. It'll cover 92% of the stroke population, early supported discharge.
And how do you network with all those, your work as a program manager nationally? How do you link in with all those?
We've a clinical advisory group, which is made up of a clinical representative from each of those sites. So we meet quarterly. So obviously we would feed back to them, they would feed back to us. So there's a very close link there. We also have a nurse lead on our programme, Fiona Connaughton. So she would have links with all the advanced nurse practitioners and the clinical nurse specialists in all those sites as well. Ciara Breen, like I said, she's an OT by background. So she would have links with all of the health and social care professional teams, both acute and early supported discharge in all the 24 sites as well. And then Renan Collins is the clinical lead. Like I said, he would link very closely with his clinical counterparts as well. We have an oversight group as well with the stroke strategy, which is really important. It sort of keeps us on track. We'd have members from the Department of Health there, the HSE, academia, we've patient representation. So there's a lot of people involved in getting the stroke strategy implemented, which is really wonderful.
Yeah, it's a big network, isn't it?
Yeah.
So let's go back, before we finish up here, let's go back to the main message again. So that we just hit this home here. FAST, bring it home to me again.
So F for face. So is your face drooping on one side? A for arms. So can you lift both arms up and is one dropping? Is there one that you can't hold up? S is for speech. So is your speech feeling slurred or a little bit garbled? And we've actually had an example from somebody who was home alone and they realised they couldn't send a text was the speech piece for them. So they weren't speaking, but it was still a communication that was affected. And then T for time. So that's, I suppose, the main piece for this particular campaign. Every second counts. If you suspect any one of those, don't write it off. Don't wait and see. Make the call to 999 or 112, whether it's for yourself or it could be someone on the street. It could be someone in your home, your parent, your grandparent, your child.
Yeah.
So it's just to act on it straight away. And like I said, if it's nothing, that's brilliant. They'll be more than happy to send you home from the hospital completely fine.
Yeah. Better safe than sorry.
Yes.
Yeah. Don't be afraid to ring the number. Absolutely.
Exactly.
Okay, Sinéad Coleman, Programme Manager with the HSE National Clinical Programme for Stroke. Thank you very much for joining us today.
Thanks, Virgo.
I hope you got something from this episode. If you did, please share it with a friend or colleague. And thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.